Monday. How to pass NCLEX. If you're watching this, you will leave this class knowing all about hemodialysis, the important concepts, the safety points, and you'll be able to pass any NCLEX question about hemodialysis. That's the goal for today. You are here for a purpose. And if you want to join me on today's live to do a case study discussion, then go ahead and send an email to support@remarreview.com to join my live study group. But guys, hemodialysis is the subject. So that's what we will be discussing. I'm going to walk you through it just to make sure that for NCLEX, you will be amazing on those questions. I do want you to have the V2 because a lot of what we talk about today actually comes from my favorite book on the planet. My favorite book on the planet is Quick Facts. And hey, if this is your first time joining, my name is Professor Regina. I have been an NCLEX instructor for over a decade now. Surprisingly, I have helped nursing students all over the planet pass this test. I'm going to help you too. But we all have to agree right now, I'm the #1 NCLEX instructor on the planet. Yes, I'm here every Monday. Every Monday at noon, I'm here for you. Every Wednesday, I'm here for you. And this is what we're doing. Also, guess what? This is the month of June. And so we have the good times of also doing Remar Nurse University. We will be making our way through the student workbook tonight, going over pharmacology. I'm back at it again tonight at 8 p.m. Eastern time, 8 a.m. if you're in the Philippines. If you're in Kenya, you have another time if you're in California. But the whole point is that Remar Nurse University is going down tonight again at 8 p.m. So check it out. I don't want you to miss it. The whole goal of Remar Nurse University is to keep you consistent. So when you are doing Remar Nurse University, you know, hey, I'm doing RNU, but I also have a work to do in the V2 as well. So it's really for my students that are taking my program in the V2, help give them an extra push. It's not too late for you to sign up for Remar Nurse University. This is the website if you want to get started with it, because I even have some of the videos that we have done those previous Mondays. They're still up. And so you can catch up if you've missed any of the videos. We started at the beginning of June. Just go to remarnurse.com/RNU. You can catch up. But again, RNU is happening every Monday. So actually we will be doing a pharmacology conglomerate tonight, helping you to strengthen in this area. It is okay for you not to know pharmacology front and back. It is okay. But what is not okay is if there is an opportunity for you to study it, if there's an opportunity for you to learn it, that you miss that opportunity. That's not okay. So RNU is free. It is for you. It is to your benefit to show up for this class. Okay. All minds agree on that. Yes. And again, I'm wanting you to take the next step to get into the full NCLEX review. Some of you, even who are just studying with Quick Facts, I surprisingly am still getting questions. Is Quick Facts enough to pass the NCLEX? No, I always say no. The reason why, and I love Quick Facts, you guys know that, but Quick Facts is literally half of the program, not even half of the program. It's a book that has a lot of great content in it, but what this book does not have that my V2 has, right in here, #1, the question bank. The question bank is in V2. That's going to help you prepare for your case studies. That is going to help you prepare for your priority questions. The Quick Facts book also does not have delegation, EKGs, acid-base imbalance. So those important topics, you still need to learn them. You still need to study with them. So that is why I encourage you guys to get the full program. So the full program has the lectures, the CAT exam, the question bank. You'll get the books. You'll also get the daily study calendar. All right. A lot of people during this year are coming off of NCLEX experiences that they're not happy with. Okay. And so I'm getting more messages on how to go about it again, how to prepare for NCLEX again the second time or the third time. That is my recommendation to you. You do have to invest, but I know that it is worth it to you. I know that you are standing on the shoulders of people who have helped position you for nursing school, help position you for, further education. And so you are working for a bigger goal than just yourself. Shout out, it's Juneteenth week here in the United States. I'm representing Mary Eliza Mahoney. This is right here. This lady right here is the first African American woman to graduate from nursing school. She is in the Nursing Hall of Fame. Okay, so we have so much, so much to live up to on our journey to being great nurses. We have a public that we can actually transform with our knowledge. And so, again, like I say, it's so much bigger than you. Nursing is so much bigger than yourself that you have to see it as something that is worthwhile, that is worth investing in, that is worth giving your time to. Because one day somebody might be wearing your face on a shirt. I don't know. I don't know. Right now, we are about to make sure you understand hemodialysis. Hemodialysis. And one of the complexities about hemodialysis that nursing students struggle with is that it is very hands-on, and some of the things you have to do in order to understand. So we're going to talk through it as if we're doing it, and I promise you, you'll feel so much more comfortable about it. All right. So this, if you want to check my important notes about the hemodialysis, particularly the accesses, they're going to be on Quick Facts pages 32 and 33. 32 and 33 of your Quick Facts book. You got to have it anyways. Okay, hemodialysis. So this is one of the most prevalent types of renal replacement therapies. So just that sentence alone tells you what we are dealing with. This is an alternative to your body functioning. All right, so it's considered a replacement therapy. This is where actually water and waste materials are extracted from the blood with a dialysis machine. So the blood of your patient, is it staying in your body or is it coming out of your body? Where does the process, where does the filtering take place? Think about that in your mind. Think about that in your mind. If we can agree that we're going to have a patient and their blood is going to leave their body while they're still alive, this is, can you guys hear me? Can you guys hear me okay? All right. Let me know. So anyways, we have a patient, blood is leaving their body, but they're still alive. Imagine the emergency scenarios that you need to be prepared for. Imagine the NCLEX safety points that you better make sure you know before you graduate nursing school. Okay, so hemodialysis, serious procedure. Hemodialysis requires a lot of understanding. All right, so anyways, blood is filtered through a machine. It is pushed through the dialysis machine through an extracorporeal circuit into a device known as a dialyzer or an artificial kidney. Okay. Oh, I hope you guys join me for this case study. I hope you guys come on. Don't be afraid. Come on. Don't be afraid. Join me for this case study. It's going to be so good. So we are expecting the dialyzer. We're expecting the hemodialysis machine to keep the patient alive by filtering waste, eliminating excess fluid, and restoring the electrolyte balance of the patient, particularly sodium, potassium, bicarbonate, chloride, calcium, magnesium, and that phosphorus. Patients need to know that if they choose not to get a treatment such as hemodialysis, they do not have time. They do not have much time to live. Okay. Because literally it is keeping them in a healthy state where they're able to function. All right. Their health depends on it. So we know, we're going to talk about the access points of hemodialysis as well, because that can be very confusing. How is this dialysis taking place? But the indications for hemodialysis, this is just the reasons why a patient may need hemodialysis, is of course if there is some alteration in the kidney function. So if the kidneys are functioning less than optimal, then a patient could be considered in kidney failure. So whether it is acute or whether it is chronic, patients will more than likely need dialysis. And dialysis is something that can be considered short-term or long-term. So chronic kidney failure, yeah, hemodialysis would be a reason why. Acute kidney failure with complications, for example, and you should know these terms, anuria, uremia, fluid overload, any type of metabolic acidosis, or hyperkalemia. Hyperkalemia. Drug overdose. If a patient has consumed a toxic substance and we need to get it out of their bloodstream quickly in order for that patient to make it, dialysis is an option. Also, sepsis is an option as well. Okay, so when you're studying dialysis, the important concepts that you want to make sure that you're asking yourself, and these are the questions I'm asking you today. Why does a patient need it? Is it improving the patient's optimal health? How is it done? Okay. What medications are involved? And what are my priorities during an emergency? What are my priorities during an emergency? Let's go over the mechanics. If you have not seen a machine before, this is it. So for NCLEX, the most important part of the machine is the functional unit that is replacing the kidneys. This is called the dialyzer. The dialyzer. And so this acts as the location. It is filled with, and I know I probably got some renal nurses in here. It's filled with a fibrinous membrane, okay? And that is what the blood passes through to clean and remove waste. And it is done. So it is done to the best of the machine's capability. Now, there are so many limitations with this dialyzer, but it is the best that we can come up with. Okay. It's the best that we can come up with. You think about it, the kidneys are functional how often in the human body? In the human body, how often are the kidneys working to clean the blood? The kidneys are working what? 24/7. They are working nonstop to clean the patient's blood. So when you have to depend on a dialyzer, we know that the cleansing that takes place is done not 24/7. Okay. It is done for short periods of time. So that means that your patient is still operating, or their body is still trying to operate in a toxic state. Okay. Still trying to operate in a toxic state. So that is a deficit of a dialyzer. Okay. You can't have a patient on it 24/7 like a kidney. So what is the idea of quality of life? All right. What are we encouraging our patients to do when they're not connected to a dialyzer? That's the education in nursing. All right. The dialysate is the solution that is used. The hemodialysis unit, this is a machine. And really what you want to know for NCLEX is that there is certain components of this machine that are going to help to remove the blood from the patient's body, put it through the dialyzer, and return it back clean. All right. Blood pressure, vital sign monitoring, extremely important. Heparin also is extremely important, and the ability to be able to push or pump this blood through the machine. Now, let me ask you, I'm trying to think if I have it as a later question. I don't think I do. Let me ask you, I took some notes in my phone, actually. Let me just look at them. Okay, let me ask you this. So heparin, why? Why is heparin given? Why is heparin given to the patient? Why is heparin given to the patient? Somebody put that in there. I'm asking, why is heparin given? This is really good. So people are saying clotting. Does heparin dissolve clots? Does heparin dissolve clots? Yes or no? I saw somebody put it helps to break down clots. So remember, heparin does not dissolve clots. Okay, that's number one. My next question is this. If we are giving heparin to a patient to prevent clots, are we trying to, let me see which one. How do I say this? Are we trying to prevent the clots inside of the body or inside of the machine? Where are we most concerned about the clots? Has anybody ever asked you that before? That's why you show up here. All right. Are we worried about the clots forming in the blood or the clots forming in the machine? I have two different answers. I have two different answers here. So in the machine, in the blood, in the body. Okay. We are worried about those clots forming in the machine. Right? Very important that the clots do not happen as it is going through that machine. It is an artificial environment. It is an artificial environment. And we know that if blood is not constantly moving like it is in our body, our vessels, our heart, they're contracting, they're expanding, they're keeping everything going, right? In that machine, the environment changes. And we know blood, if it is still, it knows to do one thing, and that is clot up. All right. So that's good. That's the reason why. Okay, let me move on. So anyways, we're talking about hemodialysis. I want you to understand for my visual learners that what's happening here, and because again, if you've never seen it, you've never seen it. The blood is leaving the body through one place and it is returning back into a different place. So there are two access points to the dialysis process. Okay. So the way the blood leaves is not the same way that it returns. Does anybody know, or we will talk about it. The blood is going to leave through is it the arteries or the veins? This is important for us as a review. That dirty blood. Okay. Do I have it here? Put it in the comments. I'm going to go back to it. Okay. So, just going back really quickly, I'm talking about the access points, right? And in quick facts, very important for you to know the three here in quick facts on page 32. And I'm just going to tell you, if you don't have this book, because I know you'll be getting it, you're going to have, you can't see it, grafts, fistulas or shunts, and then you're going to have central venous catheters. So you can have grafts, okay? You can have AV grafts, AV fistulas, or catheters. Let me go back to here, because this is where the language is very important, and for you not just to sound cool like but for you to actually understand. So for immediate access, and this is in quick facts, for immediate use, you can use the very quick cath. Okay, now on the nursing unit, they will say these two terms. They'll say, oh, the patient has a vas cath. Have you ever heard that? Or the patient has a permacath. Okay. Now, some nurses will just write that down. Patient has the history of a vas cath or a permacath. Nurses will just write that down and keep it pushing. But you need to stop and ask, well, what does that even mean? What does that even mean? If a patient has a vas cath, well, it means that they have a central venous catheter. That's a vas cath. It is a temporary access point to dialysis. Okay. Temporary access point. Now, because, and you have to think about it, because the fistulas and the shunts, how long do they take in order to heal? If a patient needs to have an AV fistula, right, it could take 3 months. It could take 4 months for that fistula to heal. And we want patients to actually have the AV fistulas. If you have a choice between a AV shunt, an AV fistula, or a cath, we always want the AV fistulas. We always want the AV fistulas. I remember it because you have AV shunts and AV fistulas. I remember the F in fistula as first. You want to have that AV fistula because it is the gold standard, right? It lasts the longest, but it's going to take the longest to heal. It's going to take the longest to heal. So I put here the caths because those are the ones that are going to be used first. So I asked the question, do you know the difference between a vas cath and a permacath? Okay. They're both going to be venous access devices. The difference between the vas cath is going to be a superficial endpoint. The permacath is going to be tunneled underneath the skin. Let me see if I have a picture of it. Okay. So for example, if you have here the internal jugular vein, okay, as a catheter point, which is cool, a central line catheter point. If it is a vas cath, you're going to be able to see it coming right out. Okay. You're going to be able to see that endpoint. It'll be terminal. You'll be able to see it. The permacath is going to be tunneled under the skin. This is to help to prevent infection as readily as a vas cath. Okay. Now let me go back to the 3 vascular access points, because I hope you understand them a little bit more. All right. We always want the AV fistula. That is going to be the first one. That's going to be the gold standard. It lasts for years and years and years. We don't have to worry about it getting infected as much. Very important. Okay. Very important to know. Most likely, though, patients will have some sort of immediate device needed. So that is going to be what I have here, subclavian, internal jugular, or femoral vein. Okay, and that is that access, that central venous catheter that I wrote in quick facts. So I want you to just take a little bit of time, make sure that we understand what we're reading. All right. So the pre-dialysis assessment is going to be the client's history, clinical findings. Does the patient require, is it time for dialysis? Is our patient reporting things? What are some of the things that our patient's going to report if they have a need for dialysis? And these are really late signs. Of course, we're going to have fluid, we're going to have edema. Our patient's breath may smell like what? Patient's breath may begin to smell like urine. They may have the clinical findings we may have, yes, the weight, okay, we'll see that increasing. Patients may have a metallic taste in their mouth. Why? Why will a patient have a metallic taste in their mouth? If NCLEX asks, what is that a result of? Mrs. Lethargic, hypertensive, uremia. Yeah. Okay. That buildup of uric acid will cause the patient to have a metallic taste in their mouth. The laboratory results, the creatinine is going to be elevated. So these are all things that are going to be important response to previous hemodialysis. So if you tell me you have studied for NCLEX, I should be able to ask you several questions like I'm doing now, and you should readily have the answers to them. So yes, why does your patient report they taste metal in their mouth? What are the 3 different access types to dialysis? What's the difference between an AV shunt and an AV fistula? What's the difference between a intravenous central catheter to the AV shunt? All right. I'm going to talk about the exit points. So people that are watching. Yeah. Okay. So here we go. The vascular access, again, it is in immediate use. I asked the question here, do the arteries or veins handle the dialysis? Yes, no, I asked the question, do the arteries or veins handle the dirty blood or the clean blood? That's what I asked. And I don't think I gave an answer to it. I was looking for it in the comments. So remember, the red access port represents the arteries, and the arteries are the way that the pre-dialysis or the dirty blood leaves the body. When that blood is cleaned and filtered, it returns through the veins, which will be the blue port. Okay. So red is dirty blood out, blue, clean blood in. Good. Okay. AV fistula, AV graft. I covered them in quick facts in detail. Please govern yourself to read that book. The nursing considerations that you need to be mindful of before beginning the hemodialysis for your patient. You got to make sure that the lines are primed, they're ready to go. The dialyzer is ready, the filter is clean, and you removed any air. Air embolism is a complication that can happen during dialysis. Of course. You got to test the alarms on the machine, respond to any alarms as quickly as possible. For NCLEX, it is just like a ventilator alarm. There will be alarms that you will not know and understand as a new graduate nurse, but you still need to have the steps of prioritization based on how your patient is clinically presenting. And the one thing about it is there's not a set step of do this every single time, because your patient may present differently. So we're going to look at some symptoms and we're going to see and say to ourselves, do I know what to do if my patient has this or this? Okay. We need to make sure that all the connections are tightened and we are making sure that we understand the sterility of this procedure. Okay, because remember, every time a patient is connected to a dialysis machine, it is a sterile procedure. Even if NCLEX says, oh, this is their same machine, this is their same nurse, this connections are the same connections, it's all sterile. Okay. All right. Some things that we are always monitoring are vascular access. We are monitoring our patient's blood pressure, the machine pressures, flow rates, vital signs, how the patient is responding to the shift in fluids that is happening in their body. And like I mentioned before, infection control, very important, very important. The complications or some complications of hemodialysis that are very important are shortness of breath, hypotension, muscle cramps. So you think about muscle cramps because you have the electrolyte changes. Okay. Exsanguination. What is that term? It's super serious, but what does it mean? Exsanguination. Dysrhythmias, air embolism, chest pain, and dialysis disequilibrium. Dialysis disequilibrium. So, are you guys with me here? All right, this is our language. This is the language of nurses. These are things that we are monitoring for. Again, if you are going to be a dialysis nurse or work in a dialysis clinic, you will be very, very, very aware of the seriousness. Okay. And the thing about dialysis nurses is that's very scary because usually these are standalone places. These are standalone places for treatment for patients. So how much even more monitoring do we have to do? So much more, so much more. Nursing management, of course, the pharmacologic therapy that goes along with this patient. Normally, patients are not just getting dialysis. Normally, they're getting what? Blood pressure medications, right? As well. They may be getting insulin or metformin, another comorbid treatment for something else totally different. So we're constantly monitoring these patients. They may be getting diuretics. Okay, so just be prepared to know those classes of medications. And again, if you've been doing Remar Nurse University with me, then you know that we're going over all of those. Okay. Infusion, iron infusions. I put this on here because I wasn't aware if you knew if one of the complications of chronic kidney disease is anemia. So sometimes NCLEX likes to pair dialysis with iron infusions or anemia. All right, so be mindful of that. And then nutritional and fluid therapy. Well, what is the nutritional requirements? What does that diet look like for patients who have indeed have to have or been prescribed dialysis, hemodialysis? Okay. After the dialysis, what are we looking for? We are looking to make sure that the additional fluid has been removed, that the patient's laboratory values are returning to normal, that they're having current and normal electrolyte and acid bases. We do not want to see any kind of acidosis in these patients or alkalosis either. Okay, I have my case study question. Is anybody getting on with me today? These are the questions that are going to help us to see if we can just talk through NCLEX. Let's just pretend like we're doing NCLEX together. It is a group. It's a new thing. It's a group discussion. I know I have some Remar nurses on. Hello. Nurse Brown, how are you?
Hello, Professor. Can you
How
hear
are
me?
you? I can hear you very well.
I'm good. I'm good. So
Okay.
it's so nice to see you, Professor.
Oh, it's so nice to be seen. Are you going to do this case study with me?
Yes, please, please.
Okay, let's do it. I also have here Nurse Angelo. Hello, how are you?
Hi, good morning.
Good morning. Are you in the Philippines?
Oh no, in Las Vegas.
Oh, Las Vegas. Okay, because you said good morning. Oh, okay. So yeah, it's morning in Vegas. It's morning in Vegas. Are you here to do the case study with me? You ready to get started?
Yes,
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 let's
Mr.
do
Regina.
it. Let's do it. Okay, so here we go. 65-year-old male client is beginning his treatment with hemodialysis. Okay. The client has chronic kidney failure, and he asked the nurse the following questions. All right, Remar nurses, let's get ready. Let's get ready. He's asking you these questions. What you're going to say? Dialysis. The first question is this. Will dialysis, watch this, don't answer too quickly. Will dialysis help improve my kidney function? Yes or no? What do you say?
Yes.
Okay, so he's asking, will the dialysis that I'm doing help improve my kidney function? That's why I said don't answer too quickly. This is a good one. So let me rephrase it. The patient wants to know, if I start this dialysis treatment, will my kidneys get better because I'm doing dialysis? Good. This is
No, I think no, Professor.
Yeah. Okay, Angelo, tell me why the answer is no. You can help him, Nurse Brown, too.
Okay. Maybe because the kidney is not functioning normally, maybe. Yeah.
Yeah, Nurse Brown, what do you have to say too? Do you have anything to add to that?
Yeah, I think, Professor, because the kidney is already damaged, but we're doing dialysis to help to maintain the body functions.
Good job. Yes, good job, both of you. So you both have it right. The dialysis is doing what the kidneys cannot do. The dialysis is replacing the kidney function. So even if the patient does dialysis, sometimes they think, well, if I do dialysis, then my kidneys will get a rest and they will get better and I won't have to do this for a long time. But they do need to understand that them doing dialysis does not improve their kidney function. Okay. So I know that's an NCLEX point, and I wanted to make sure that we went over it today. So good job. Good job. All right. I'm going to ask another question. This is the second question here. Okay. So I said no, we went over that. Second question. What the patient asks you, what does the dialyzer do to help me? What did I tell you guys the dialyzer did? The dialyzer is a part of the machine. So it's a part of the machine, and its job is to what? It's not the solution. It is the
filter the
Filters
blood.
the blood.
Yes, good job. That part is important to know. The dialyzer filters the blood for the patient. Great job. Okay. Next question. During dialysis, does the dirty, unfiltered blood leave my body through my arteries or my veins? What did I say? The red is for the dirty blood, and the red represents what? The red port represents what? Arteries or veins? If it's red, it represents
the veins.
Oh, we split on the answers here. That's okay. The red represents the arteries.
Arteries.
Yay, it represents the arteries. Cool. All right, Nurse Brown. Okay, this is the critical thinking question for you, Nurse Brown. All right. It says, I can get a vascular catheter in either my groin or my neck. Okay. But which location is going to be better? Which location is going to be better for the patient? Go ahead, Nurse Brown.
Is the neck is more convenient, Professor?
It's more convenient, and it's another word that begins with a C. Can you think of it? It's more convenient and it's more clean.
Yes.
Yes. That is going to be very important. So good job there. Okay.
Thank you, Professor.
Cleaner. Yes. Okay. Nurse Angelo, tell me this. The patient is doing hemodialysis only 3 times a week. So what work does that patient need to do at home in order to continue to be healthy? Like what kind of things does the patient need to do to be healthy at home? In terms of, talk about their diet, talk about things that they are avoiding. because this patient will be considered a renal patient?
I think the patient should be not doing any extraneous activities like
Mhm.
um
Yeah,
yeah
that's good.
yeah, I think that would be fine. Yeah.
And what about the sodium level? Should the sodium level of the patient be monitored?
Yes. Yeah. Sodium.
Definitely.
Yeah.
And then what about Nurse Brown? Can you talk about fluid? What type of fluid monitoring should the patient be aware of? Or what is their relationship to fluid when you are on dialysis?
But the doctors tell us how much fluid they're gonna take during our 24 hours. They will tell.
Exactly.
Yeah, and
Exactly.
also, sorry, they avoid the crowd. The people who have dialysis avoid the
Mhm.
crowd. Also, they don't eat red meat like diet. Also, we can.
Exactly. So you have to avoid protein. You
Yes.
cannot have high protein foods that will put a further burden on the body to get rid of it. Put a further burden on the body to get rid of it. Wow. Okay. Also phosphate levels as well. So great job. I think I have here fluid restriction. Patient needs to be on a renal diet, low sodium, low potassium, low phosphorus. So thank you so much. I don't know if you guys knew you were going to be doing the case study, but these are the type of sessions that I love to have. This is one of the reasons why I'm doing RNU for the Remar nurses, so that we can come together and talk about these things. Now, Nurse Brown, are you excited to take NCLEX, or have you already passed? I know Nurse Angelo has already passed the NCLEX, so he's good. Nurse Brown, have you passed already?
No, no, Professor. I'm still preparing for my NCLEX.
You're still preparing for your NCLEX. Okay. Can you give us a month that you're going to be? Can you give us a month that you are going to be testing for NCLEX? Is it coming up? When is it?
Professor, actually, I need to apply for my ATT. So soon as I'm gonna apply my ATT, then actually, V2 I bought since January, and I'm studying. I'm studying over and over and over.
Okay. Wow. Well, that's what I'm talking about. Being ready for opportunities when they come. So as soon as you get your ATT, you can go ahead
Yeah.
and take that exam. That
And
is
I
amazing.
and I believe God give me time more prepared. Get yourself more prepared and strong.
Yes, exactly. And that's what you have to do. Time can be your enemy or time can be your friend. And
Yes.
time, if you give yourself and you start early, you can do what you're doing, which is preparing and over preparing and making sure that you know everything. And I'll tell you, you did really good in the questions today. So I know that you have covered this part. All right. Do you have your quick facts? I know you seems like you knew those little details that I wrote in quick facts. So yeah, you got it. Yep. I knew it.
Can I show you, Professor, my quick facts?
Yes, you can show me. Let me see it. I love it. It's a little different, but I see the writings and I see you wrote, wow. I see you have highlighted it extensively.
Yes. So
Yes,
I'm studying.
that's what it looks like to use that as a workbook. Quick Facts is also a workbook, and you're doing Remar Nurse University. Can't make that. Anxiety workshop. Yep, she's ready. Wow. Thank you so much for joining me today. You got the workbook, you got everything. Yes, you guys.
Thank you, Professor. Thank you
Yes,
so much.
thank you so much for joining me today. I'm looking forward to your testimony. You got to promise me, Nurse Brown, you'll come back and give your testimony, okay?
I will, Professor. I will.
Okay, I'm going to be looking for it.
Thank you, Professor.
Thank you so much for coming to the study session today. Nurse Angelo, how are you doing?
Yeah, I'm good. I'm good. I passed my exam last. I took my exam last Wednesday, June 12th.
Phenomenal.
Yeah,
Phenomenal. Talk to me about how many questions. How many questions did it
I
take for you
I
to pass
did
your exam?
I did 150 questions. I
You did.
almost Yeah, all of them. I did. I almost consumed my 5 hour test.
Now, wow, 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 wow. So
Yeah,
you were literally in there and you said, I wasn't leaving without my license. You said, no matter what, I'm
yeah,
getting this license. See, I'm telling y'all, some of y'all at home are too afraid to take this exam. And I want you to look at Nurse Angelo, who now has his nursing license. Was it your
yeah.
first time testing?
Yes.
It was your first time testing.
Yeah. Actually, the questions was so hard. I can't believe it. But all the contents in your review helped me a lot.
So, Nurse Angelo, like, talk to me about the thing when you were studying, what did you think was most difficult for you?
Um, Most difficult. Maybe the actually I'll tell you uh the most difficult is the what's that the like, for example, there's a case, right?
Mm-hmm.
The case sometimes it's very tricky. You have to really critically think about the cases, and
Mm-hmm.
you have to choose the right one. And with your content, I almost got I think I got the right answers because I passed, because
Yeah.
some of the questions are very y- I took time to answer it. Like, you have to think about it, all the
Mm-hmm.
symptoms,
Mm-hmm.
all the, for example, like the congestive heart failure. You have to know everything about it, like in depth.
Yeah.
Yeah,
So
it's very
I
hard. It's very hard for that
it
one. Like, yeah.
go ahead. Yeah, no, it's not easy. I'm almost like I want to know, like, were you nervous? Did you just go in there when you took your exam? Like, you feel like, for me, I feel like you're kind of a relaxed person. Like, it is what it is. How was it for you the day before you tested?
Actually, I didn't follow your advice. I didn't follow your advice not to review before the day, a
Mm-hmm.
day before. But
Mm-hmm.
I still, you know what? I still played all your videos, all the notes I have.
Mm-hmm.
I take a glance out of it. Like, I read it. I read it fast. I read it I cram. I'm a crammer, actually.
So you just did your own thing. Like, you
Yeah,
just
yeah, yeah, yeah. Yeah, because that's how I study.
Mhm.
Yeah.
Um, so I hear you speaking. Is English your first language?
No, no, no. I'm a Filipino.
Mhm.
I'm from the
Okay.
Philippines.
Okay. So
Yeah.
when you decided to study, so okay, you said you crammed. How long did you study for?
Uh I actually, I followed your calendar, the
Okay.
30-day calendar. I studied it, and I started like first week of May.
Okay.
Then I ended up like end of May, right? Then the last 2 weeks before June 12th, I just reviewed everything. Everything.
Okay.
I watched your videos, I think twice, and
Okay.
all the notes that I have, the quick facts and I read it again and
Mhm.
and again.
I'm telling you, I'm telling you. I love that you decided to come on here
Uh-huh.
because you are a perfect example of just going for it. Just
Yeah.
going for it. Like, go for it. Do what you need to do. I don't know if you came to the Monday and Wednesday classes,
Yeah, I did.
but
I did.
you did?
Yeah.
Yeah. Okay. So I'm telling you, were all in. You
Yeah,
literally were
I
all
also
in
watched
then.
some of your videos.
Did you
And
do questions in the question bank, Angelo? I'm trying to
yeah,
get the secret sauce for everybody.
almost
Okay.
I did like almost 2,000
Okay. So you
2,000
got those work.
questions. Yeah, I trained myself to answer the questions.
Mhm.
Uh, uh, because it really helped me a lot with the question, all the question banks, because it trained me how to do the test on the day itself. Yeah, it,
Yes.
it trained me a lot.
Yes, and I love that because you ended up needing to have that type of training to not give up. If it took you
Yes.
almost 5 hours, if you spent 5 hours in one day doing NCLEX prep and you come out with your license, the
Yeah.
reason why you come out with your license is because you have understood I need to stay focused. I need to stay in the game.
Yeah, it's
So
really it's really a marathon.
yes, it's a marathon.
Yeah.
Exactly. Exactly.
Yeah.
I don't just
Yeah.
say this. So I love that you come on and you're like, yes, I did it. I did the review. I did 2,000 questions in the question bank, which I don't know if anybody's ever said they did that many. I usually
Yeah.
people say they do 700 or 1,000, but
Hmm.
on your test day, you were able to get your nursing license. And at the end of the day, that's all that matters. So
Yeah.
everybody
Glory
that's
to God
watching
be the glory.
Angelo, this is a licensed nurse. Okay.
Yeah.
So who's next? Who's watching Angelo? You can't say anything about Angelo except that he passed his NCLEX, and that's all that matters. And I
Yeah.
love
So
that.
content is really the key.
It is.
The content. Yeah.
Yeah, yeah. Content is the key.
Yeah.
What made you want to come on, or what did you want to say here today? What made you want to come on here and give a testimony?
Uh, you know what, the review, oh, sorry. The review, your review is very, I think it's really one of a kind. You really, it really helped me a lot, answering the questions by reviewing all the videos. It's like talking to me, like it's like you're with me in the test. During the
Nice.
test. Yeah, I still hear your voice, like, no, this is the right question, this is the right answers, this is the right answers. Yeah, every question is like, I'm still thinking of you. I still hear your voice.
Wow.
Yeah.
Wow. Thank
It
you
really helped
so
me a lot.
much.
Yeah.
Thank you so much. Congratulations. So, what type of nurse do you want to be?
For now, like, I'm thinking of, like, in the med surge or maybe in the PACU. Yeah.
PACU? Yeah.
Yeah.
Okay.
Yeah.
Awesome. Awesome. Well, congratulations, Nurse Angelo. You have made my day. You and Nurse Brown just coming on. And guess what? I'm doing Remar Nurse University tonight at 8 o'clock, but you don't have to come. You don't
Yeah.
have to show up.
Officially a rumor nurse. Thank you so much. Thank you so
You're
much.
welcome. You're welcome. Bye
Bye bye.
bye. Oh, man. That was the testimony. That was the testimony that somebody needs to see. Somebody needs to see Nurse Angelo, and you are saying to them, you're saying to yourself, I can do this. I can 100% do this. First time testing, international nurse representing the Philippines, 150 questions, almost 5 hours. But guess what? No excuses. He didn't give up. He left there with his license. He left there with his license. And you know what he did? V2. He did V2. He followed the 30-day calendar. He crammed. He studied the day before his test. You know, some of the things he did, I said do. Some of the things he did, I didn't say do. But he had to figure it out his own way. And that's what this is about, taking control of your process. So if you are not actively doing that, if you are not waking up with a plan and knowing that today I'm studying medication administration, orthopedics, if you don't have that in your life, you're wasting time. You're just wasting a whole bunch of time because it's not going to happen for you unless you make it happen. Okay. So I have during Remar Nurse University, I get the discounts for you to make sure that if you're doing the 30-day program, you have a 30-day price. You also have a 30-day calendar. If you're doing the 3-month or if you're doing the 6-month, it is all there for you to do that. But Like, again, the question bank, the videos, the quick facts book all work together. Okay. And these videos, I always tell you, they're not long to do. 9 minutes, 6 minutes, 8 minutes. Some of you have been studying for years. You've been studying for years, and it's not because you can't pass NCLEX. It is just because you don't have a plan. Okay. You don't have a plan. And let me help you figure it out. Let me help you figure it out to help you get to the next step. Because everything that you have in your life is for a purpose to help you get to the next level. Even showing up here, you're not just doing this just to be doing this. The goal is that you make it to give the testimonial. Okay. I love you here, but some of y'all need to take this pledge that this is my last Remar Nurse University. This is my last Monday motivation. Okay. This is it. This is it. Because just doing that and saying it out loud will help you do what needs to be done. Okay. What needs to be done. So I hope that I can help you inside of the V2. I love what we do here, but that training that takes place is inside of V2. Okay. All right. I see you, Sam, coming soon to take my testimonial. All right. So thank you for doing those discussion questions with me. The next part of Monday is this. It is Monday motivation. And I'm telling you, listening to this will help you to see that you are right where you're supposed to be for this week. Overwhelming circumstances are always met with God's overwhelming strength. And here we are usually talking about NCLEX content. Let's look at NCLEX content for NCLEX. But what about the content that is in your life? Meaning, what about the things that are going on in your life? Your health, your living situation, your car, your job, your family, what's in your closet, what's in your refrigerator, the content of your life. Are you the type of person that you're just naturally grateful? Okay, you're just naturally grateful. Or are you the type of person that has to be taught? you have to be taught lessons in order to be content, because we're talking about being content with the content. Okay, content with the content of your life. And this is the scripture reference here. And again, the question is, are you going to be content with what you have, or do you need to be taught how to be content? Paul writes this in Philippians: I know what it is to be in need, and I know what it is to have plenty. I have learned, he had to learn, I have learned the secret of being content in any and every situation, whether well-fed or hungry, whether living in plenty or in want. What's the secret? I can do all things through him, through Christ, who gives me strength. Okay. And what I love about this is that Paul is speaking to everybody. And Paul is speaking to people who right now, they have a lot of needs. They are not getting their everyday things provided for. When Paul is writing this, he's in prison. So he is literally a prisoner saying, I know what it is to be in need. When you're locked up, and he's locked up for not even being a criminal, he locked up for preaching the gospel. He's saying, I know what it is to be in shackles and chained and burdened. But watch this. He also says, I know what it is to be well fed and to have plenty. All right. Which is a lot of us. Most of us have more than what we need. But there is still a struggle. There's a struggle to be happy and content when you have little. And this is what a lot of people don't realize until it's too late. There's also a struggle to be happy and content when you are well fed, when you have all of your needs provided for. There is a mental struggle to be satisfied, because the more you have, the more you want. And we see that, and we see that all the time. We see about celebrities who have essentially everything, having to do these wild and crazy acts, and having to use drugs and all substance abuse and all kind of things, just destroying everything, because they have not learned how to be content during the well-fed seasons. And so Paul is saying, hey, it didn't naturally happen for me. I had to learn this secret. What is the secret? The secret is more things? No. The secret is more money? No. The secret is more love, more relationship from other people? No. More self-confidence, more motivational speaking? No. The secret is I can do all things through more Christ. It's Christ. And that is the understanding of being content with the content. Oh, my goodness. Because you have to be. The things that are happening, you got to be okay with what it is. Because at the end of the day, you get your strength from who? You get your strength from who? Right? And it is through the strength of Christ that you're able to make a difference, that you're able to be happy, that you're able to be in your right mind, because it is a struggle to live in poverty and live in lack. Man, I seen that. I seen it. When I leave America and go to any other country, there is a certain level of poverty that I'm exposed to, right? But also when I come back to America, I see that it is also a struggle to be in your right mind here when you have so much. I mean, America is a place, it is the land of plenty, but people here are not living in reality. The mind, okay? The mind. And so guess what? You want to be a nurse? You're going to see all of this. You're going to get all of it, all of it, all of it. But your understanding is, I can do all things through Christ who gives me strength. Not in my own strength, but through Christ who gives me strength. So let's remember that. Our takeaways for Monday Motivation. Number one, life is full of ups and downs. Okay. If you're living a well-fed day today, thank God for it, because who knows what's coming around the corner tomorrow. And that's just the reality. Nobody's promised tomorrow. Nobody's promised that tomorrow will be perfect for you. What God has promised is that he won't leave or forsake you. So you have to be content. Second is your own strength will fail you. It will. Okay. The young men, when they're running, they grow weary. They grow tired. All right. But those who trust in God, what? We can endure. We can mount up on wings like eagle. Y'all gonna need those wings when y'all taking that 5-hour NCLEX. You better be praying your way through that thing. It starts now, though. It starts now. Number 3, learning to be content is learning to trust in God for your needs. Yeah, that's what it means. It means whether your bread and your water is sure, it is sure because of the Lord, not because of anything that you have done. All right. You are here to be a blessing to somebody else. You are here to help somebody else get to the next thing. And so if you can keep that sort of humility, nursing can be a beautiful place. All right, guys, I love today. Shout out to everybody coming on here that prioritized this subject information, that just said, I'm going to take out some me time. I'm going to get with my people, and we are going to get ourselves on the right path for this week to getting our nursing license. A lot of great things happening this week. We got Remar Nurse University popping off tonight at 8 p.m. Eastern time. Shout out to Wednesday. It's Juneteenth officially. I will be representing the first Black nurse to ever graduate nursing school in a time when education was not thought to be appropriate for people of color. And so for her to go through nursing school, graduate, come out, couldn't find a job, y'all. Could not find a job at all. Of course, why would she be able to find a job? And so she had to essentially start her own business, private duty nursing care. I love it. I love it. Y'all know I love the entrepreneurship. So Mary Eliza Mahoney is our she's our star for this week. So I just love I love those who have sacrificed so much in history so that we can have all that we have today. So you're not here alone. Somebody else worked very hard to set a path for you. And I want to make sure that you're able to get that nursing license so that you can pay them back. Okay. Pay them back. Many people would have prayed to see your day and your time. So let's not disappoint. Let's not disappoint. All right, guys. So I'll be back on tonight at 8 p.m. Eastern time. Winning Wednesday also will take place this week, 9 p.m. Eastern Standard Time on Wednesday. I love learning the content with you all. I hope you have a blessed day. It's a beautiful Monday. I will see you tonight. Thank you for watching. Bye.